Okay, let's talk about one of the most frustrating topics for pretty much any American: the absolutely absurd cost of healthcare. I mean, why is it so expensive? We're going to unpack that exact question, and we'll be using the book The Primal Prescription by Dr. Doug McGuff and economist Robert Murphy as our guide.
You know, if you've ever stared at a medical bill and just felt that sinking feeling, that mix of confusion and total frustration, you are definitely not alone. It's this universal sense that the system is just broken. But figuring out why it's broken can feel impossible, like it's all tangled up in politics and confusing jargon.
And to put a number on it, way back in 2014, the average cost of healthcare for just one person in the US was a staggering $9,400. And as we all know too well, that number has only continued its relentless climb upward. So how on earth did we get here? Well, this is where the analysis gets really interesting. It kind of steps away from the usual political blame game. The authors here argue that the root of the problem isn't just one party or one single law. Nope. They say it's a century-long chain reaction of well-intentioned interventions from both sides of the aisle that created this cascade of unintended consequences. So where does this whole story even begin? Well, we have to go back, way back, more than 100 years, to the very first critical intervention, a series of actions that, believe it or not, started to squeeze the supply of doctors. This timeline really shows a clear pattern taking shape. You see, it started small with state licensing laws, then came stricter requirements for medical schools. But the real game changer was the 1910 Flexner Report. Now, it was meant to raise standards, but it also led to a whole bunch of medical schools closing down, which dramatically tightened the pipeline for new doctors. And get this, by 1932, the cost problem was already so bad it was being officially investigated. And the impact was immediate and huge. The number of doctors per 100,000 people fell by 29% in just 30 years. I mean, that sets up a fundamental economic problem, right? You restrict the supply, but demand keeps growing, and prices are going to go up. This was the first domino to fall. Okay, so that supply squeeze was the first domino. The very next one was the creation of a system that completely flipped the economics of healthcare on its head: the third-party payer. All of a sudden, the person actually getting the care was no longer the one footing the bill. It kicked off with a government-mandated policy called community rating. So instead of charging people based on their individual risk, where a young, healthy non-smoker pays less than an older person with chronic conditions, insurers were forced to charge basically everyone in an area at the same price. This, in effect, socialized the risk. And what happens when you do that? Well, you create something called a moral hazard. Think about it. If your insurance premium is the same whether you're living a super healthy lifestyle or not, that financial incentive to take care of yourself gets a lot weaker. The book argues this created a vicious circle. The healthier people, who are now basically overpaying, started dropping out, which just caused premiums to rise even higher for everyone who was left. The economist Milton Friedman actually explained this perfectly with a really simple framework. Just think about it for a second. When you spend your own money on yourself, what's your goal? To get the best possible value. But as soon as you start spending someone else's money, or you're spending your money on someone else, the incentives get totally warped. That focus on value just disappears. And in healthcare, this creates a massive tug of war. See, when you pay your doctor directly, you're looking for value. But in a third-party system, you, the patient, are spending the insurer's money. So you want the best possible quality, no matter what it costs. The insurer, on the other hand, is spending their money on you, so they want the absolute lowest cost possible. The incentives are just completely misaligned. This whole system got locked into place during World War II. The government put a freeze on wages, so companies couldn't offer higher salaries to attract the few workers that were available. So what did they do instead? They started offering these really generous, tax-deductible health insurance benefits. And just like that, the link between your job and your health insurance was permanently forged. Okay, so let's fast forward a few decades. All these interventions start to pile up, and they create a full-blown crisis in our hospitals. The authors of The Primal Prescription use this really powerful analogy to explain what went down in the 1980s: an overflowing bathtub. So it started in 1965 with Medicare and Medicaid. This moved the most expensive patients, the elderly, onto the public tab, and predictably, costs just exploded. But instead of trying to fix the underlying incentives, the government's response was price controls, basically telling hospitals exactly how much they'd get paid for any given diagnosis. Then, another major piece was added to the puzzle, and again, this was a bipartisan thing.
In 1986, President Ronald Reagan signed a law called EMTLA. And what this law did was mandate that any hospital emergency room had to treat anyone who walks through the door, no matter if they could pay or not. So here's the bathtub. Those price controls, the DRGs, they acted like a giant clog in the drain. Hospitals had less of an incentive to provide services, so patients couldn't drain out of the system efficiently. Then, at the exact same time, EMTALA comes along and turns the faucet on full blast. Suddenly, ERs became a source of free care for anyone, causing this massive surge in demand. The result? Well, the whole system just overflows. So, with all that history as a backdrop, where does the Affordable Care Act fit in? Well, the book argues that the ACA wasn't some radical break from the past. Not at all. Instead, it was the logical conclusion, a massive doubling down on all of these previous interventions. I mean, just look at this domino effect. The goal was universal coverage, okay? To do that, you have to expand community rating, so insurers can't deny people. But that means healthy people will try to leave the system, so you need an individual mandate to force them to stay in. But if you're forcing them to buy something, it has to be affordable, which then requires subsidies. And of course, someone has to pay for those subsidies, so that necessitates new taxes. You see, each step logically required the next one. And just how affordable did it actually turn out to be? Well, the government's own projection was that in 2016, nearly 4 million Americans would find it cheaper to just pay the penalty rather than buy the actual insurance. That's a pretty powerful sign that the core cost problem wasn't really solved. And the data really shows what happened next. Between 2009 and 2014, the average cost per person jumped significantly, even when you adjust for inflation. That fundamental upward trend in costs wasn't reversed. It just kept on going. So let's pull all this together and really nail down the core argument being presented in the Primal prescription. The central thesis is really this. For an entire century, the U.S. has been stuck in a vicious cycle. Each government intervention, no matter how good the intentions were, distorted the market's natural incentives. And this created a new problem, which was then fixed with another intervention, which in turn created an even bigger, more complicated problem. There's a quote from the book that just drives this point home perfectly. The core argument is that the cumulative weight of all of these interventions is precisely what has crippled the market's ability to deliver what we all actually want, quality care at a price we can afford. And that really leaves us with a final and pretty crucial question. If this analysis is correct, that our broken system is the result of a century of so-called fixes, what does that tell us about what a real solution might look like? It's a challenging thought, for sure, and it forces us to look at this whole problem in a completely new light. Thanks for joining me for this explainer.